Where there is anxiety, there is often depression. And although anxiety and depression are often seen as two distinctly different problems, and there are many differences between them, there is a surprising amount of commonality also. In this video, I'm going to look at how common it is to suffer from both, why anxiety and depression often come together, the similarities between the two, and how a similar approach to the treatment of both can be very effective. So let's get started. Firstly, how common is a diagnosis of both anxiety and depression? This study from Holland showed that 67% of people with a depressive disorder also had a current anxiety disorder, and 75% had a lifetime anxiety disorder. So having both anxiety and depression is very common. There are a number of reasons anxiety and depression may exist together. One reason is that the anxiety may lead to the depression. The Dutch study showed in 57% of comorbid cases, anxiety preceded depression, and in 18%, depression preceded anxiety. This suggests that it's more common for anxiety to lead to depression than the other way around. And this is not surprising, since anxiety can lead to a very poor quality of life, whether it's panic attacks, agoraphobia, OCD, GAD, or social anxiety. There is no doubt that anxiety can limit your life, which can lead to depression. To understand the other reasons that they're so common, we have to look at the similarities. Firstly, the roots of both are often found in childhood. The Dutch study found that comorbidity of depressive and anxiety disorders was associated with more childhood trauma and an earlier age of onset of the first disorder. Our experiences in childhood shape our beliefs about the world and ourselves, and our beliefs drive our behaviours, thinking patterns, feelings, and even affect us physically. For example, in illness anxiety disorder, beliefs are based around how vulnerable you are to serious illness, which drives constant self-checking and reassurance seeking, which fuels thoughts that you are ill, feelings of anxiety, and even physical symptoms. In generalised anxiety disorder, beliefs that you need to worry or seek certainty or seek reassurance to prevent a disaster also lead to feelings of anxiety and physical symptoms. In depression, the beliefs are usually about yourself or the world around you, but could stem from the same events in childhood. For example, a child who has witnessed the suffering and loss of a parent through illness may develop anxiety about their own vulnerability to illness, but also believe that the world is a cruel and unhappy place full of suffering. Someone who did not feel safe or loved as a child may develop the beliefs and maladaptive behaviours associated with generalised anxiety disorder to try and feel safe. It's no surprise that their childhood experience may also cause them to have the very negative view of the world that we often see in depression. I mentioned earlier that these negative beliefs drive negative thoughts, behaviours, feelings, and physical symptoms. So let's have a look at these in anxiety and depression. Negative thoughts and anxiety may be about something terrible happening, getting a serious illness, having a panic attack, or others judging you or disliking you. Negative thoughts in depression may be, what is the point in doing anything? I'm worthless or helpless. Things will never get better. Behaviours in anxiety often include avoidance. You may not leave the home for fear of a panic attack, or do exercise for the fear of a heart attack, or go to a social event for fear of not fitting in. There is often avoidance in depression also. You may avoid going out or doing anything because you can't see the point, and you believe that you will not enjoy it and have a negative experience. The feelings part is the main difference. In anxiety, you feel anxious. In depression, you feel depressed. Although the physical symptoms may be different, there is some overlap. Anxiety may bring a racing heart, upset stomach, shaking, muscle tension, and even panic attacks. This can leave you feeling exhausted and lethargic, and that is exactly how many people with depression feel. So with so much commonality between depression and anxiety, it makes sense that a common treatment approach can help. You cannot change the past, but CBT addresses the maladaptive beliefs that the past may have caused. It also addresses the behaviours that are reinforcing these maladaptive beliefs in the present. So if you are suffering with anxiety and depression, try to get help from a therapist who will be able to guide you through CBT, or may recommend another approach that is more suitable to your individual needs. I no longer offer therapy. Instead, I just try to help people through my videos, which focus mainly on anxiety. So if you do have an anxiety disorder, check out my playlists. I have one for each anxiety disorder. Take care now.